Hello, I'm Dr. Nancy Lonsdorf, and I'm here with Dr. Suzanne Steinbaum, the Director of Women's Heart Health at Lenox Hill Hospital. She has been named one of New York's best doctors. She's a cardiologist, and she is the national spokesperson for Go Red for Women. And she is the author of Dr. Suzanne Steinbaum's Heart Book, Every Woman's Guide to a Heart-Healthy Life. So, Dr. Steinbaum, tell me about your preventive cardiology choice. Most cardiologists are out there putting in stents and doing procedures, and you are counseling women and helping them manage and prevent heart disease. So how did you take that track?
We know that 80 to 90% of the time heart disease is preventable. And it's really due to our lifestyle choices, how we choose to eat, how we choose to move, and how we really choose to go through life makes a huge difference on whether or not we get heart disease. So with the knowledge and understanding that women do worse when they do get heart disease, it's really about prevention. And the focus on prevention is especially critical for women.
I understand that women under 55 are the fastest growing demographic of people growing or increasing their heart attack risk. Now, that flies in the face of us women having thought for so many years that we have some kind of natural protection due to our estrogen or whatever, that we tend to get heart attacks later in life. What do you make of this trend of women getting heart attacks earlier and earlier in life?
As much as estrogen is so protective for women's arteries, we are seeing an increase in heart disease in women less than 55, and it's all due to lifestyle. Whether it's diabetes, obesity, or the enormity of stress that all of us are living with, we're seeing an increase in heart disease in this otherwise healthy, really women at the prime of their lives, this healthy population. And so this is a wake-up call that we have to understand that our lifestyles are superseding that hormonal protection we really have. And I think this is something we need to pay attention to.
Now, did you start out with a preventive point of view, or did you have some epiphany somewhere along the line in your medical training that led you in this direction?
Always. What I started out, I was really focused on health and wellness, but I was in the emergency room with a young woman who ended up dying of a heart attack in front of our eyes because at that time there was not the understanding that women had heart disease. So although prevention has always been in my background, it was a focus on women that I thought was so unbelievably necessary, especially seeing that.
And what would you tell women today? What would be your main message to them that might help them prevent a heart attack?
Know exactly who you are, know exactly how you live and what your risk factors are, and know exactly what you can do to make changes. It comes down to the basics, really. It comes down to diet and exercise and stress management. But if you don't know who you are, and you don't really take a good look in the mirror and have an understanding of that, you will not know what to do. And again, 80 to 90% of the time it's preventable. So figure out how you can change your life and how you can manage your life and manage stress and manage time to exercise and figure out how to take this juggling act and control it and own it and turn that into a life that's healthy.
It sounds like you need a preventive cardiologist to help you figure that one out, because I think that's a big challenge.
Sometimes I think you do.
So if you had any tips for women, maybe you had your top 3 tips, heart healthy tips. Are they about their cholesterol, or what would you tell women?
I would say, first of all, everyone has stress, and it is so critically important to figure out how to manage that stress.
How do you manage stress?
Personally, I am doing TM, and that is one of the best ways to manage stress.
Transcendental meditation.
There has been shown to be a 48% reduction in cardiovascular disease in those who practice TM. And it's a significant way to really figure out how to manage that overwhelming stress that all of us do have. I would say, secondly, we need to figure out how to exercise. how to really get your heart rate up. Every single day, do something in terms of movement to get your heart going. And so exercise is very important. And lastly, it's about what you eat. And figure out a diet that is sustainable, that is well-rounded. Fruits, vegetables, grains, nuts. Stay away from the sugars and processed foods. And those three things, you've got about 80% of it down pat.
That's fantastic. And we've just learned recently, the research has just become more known to people that sugar is probably a greater threat to them than cholesterol or possibly even saturated fat. Would you agree?
We know that sugar increases the triglycerides, increases the risk of obesity and diabetes, and that leads to heart disease. And when we look at the impact of sugar on this country in the past 10 years, there's been a 70% increase in obesity, and there's an increase in heart disease in people younger and younger, and it's really due to part of this lifestyle choice of sugar.
Well, thank you so much for sharing your tips and your insights with us today, Dr. Steinbaum. And I think she gave us some homework to do with our exercise and our diet and the stress management. Thank you very much.
Thank you.